Good afternoon, and thank you for joining us. My name is Cheree Tham. I'm the co-founder and vice president of programs and initiatives at America's Warrior Partnership. Thank you for joining us today on our discussion. We currently at America's Warrior Partnership are overseeing Operation Deep Dive, a community-based study examining suicide and self-injury deaths among the former service member population. It is being led by our team at America's Warrior Partnership, as well as researchers from the University of Alabama, with the generous support from the Bristol Myers Squibb Foundation. Throughout today's conversation, you may hear us use the term former service member, veteran, or warrior. These terms are often used interchangeably in the context of Operation Deep Dive. Today, our goal is to share with you the best practices and resources available to support prevention efforts around suicide and self-injury deaths for those who have served in the military and reside in Indiana. I am pleased to welcome Matt Hall, Program Lead of Indy Warrior Partnership. Join me today for this conversation. The Indy Warrior Partnership is America's Warrior Partnership's central Indy-based community affiliate that uses AWP's community integration model. Matt facilitates proactive community outreach to engage veterans, their families, and caregivers. The work elevates the work of the local veteran serving professionals by bridging the gaps that exist between community service providers and national resources to provide holistic support. Now that's a real technical term for what you do, Matt. Could you tell our viewers a little bit about yourself and a little bit about Indy Warrior Partnership?
Sure. Thanks, Cheree. So my name is Matt Hall. I'm the program lead for IWP here in Indiana, in central Indiana. My background is I have about 28 or so years in the Army. I've done a couple deployments stateside as well as over in Afghanistan. I continue my service today, and I've been with the Army. I've also been in the veteran nonprofit space here in central Indiana for about 7 years, working with the city of Indianapolis, and now I'm working with America's Warrior Partnership to head up the IWP event or a program here in central Indiana. And IWP is a little bit more of the community integration aspects of AWP's efforts. We've been looking for this in central Indiana for a long time and really looking forward to getting this going.
Yeah, great, Matt. And I can't tell you how excited I am to share the great work you're doing in Central Indy and how we can work together with Operation Deep Dive and as a community to develop an upstream prevention approach to suicide and self-injury deaths. As we discuss Operation Deep Dive and local suicide prevention efforts, I encourage our viewers to type out any questions in the comments section. We will answer them live, as many as we can, and the ones that we are unable to get to today, we will contact you directly regarding your comment or your question. Matt, before we begin, can you share with our viewers a little bit about the landscape of Central Indiana, particularly around your veteran population? And I mean, you've been in this space for a very long time. Can you tell us a little bit about Central Indy and the veteran population and what you've seen with working with them?
Sure. And for reference purposes, I like to use the VA's GDX data. I know the census just came out, but the census is one point in time. Through the GDX data, we have a little bit better of an idea over several years of what our landscape looks like with regards to veterans. So using that data, we have about 54,000 veterans in Marion County. And for those who don't realize that Marion County and Indianapolis share the same borders, so it's the same size. So Marion County is basically the same thing. 54,000 veterans in Indianapolis or Marion County, and about 115,000, another 60,000 in the surrounding counties around Marion County. So out of about 115,000, if we use some of the estimates from the VA that only about 40 to 60% of veterans are actually registered or actually touching the VA, we can almost double that number and think that there's almost 230,000 veterans in central Indiana. So knowing that and knowing some of the populations and how they've increased, decreased, seeing some of the ages really gives us a good idea that we have a lot of veterans here in central Indiana.
And just from the time that you've been there, can you so Marion County is quite a large county. Does Marion County have both a rural and urban kind of piece to it, or is Marion County just 100 strictly, urban?
No, there are definitely differences. There are farms in Marion County, and there's also the downtown district. So a lot of these suburban areas go north to south, and when you start going east to west, we get a little bit more rural populations. So definitely the counties to the east and west are more rural, and the counties to the north and south are a little bit more a combination, more suburban, if you would.
Okay. And throughout the years, not just with Indy Warrior Partnership, but also the work that you've done previously in Indy in the veteran space, have you noticed any differences between veterans and what they're seeking and in the urban, and a difference in those that are in rural, or is it does it seem about the same, or what are some of the kind of the things that you've seen with the differences within Marion County that are rural and urban with your veteran population?
So I'll say that it's the same but different. And in that, I mean, everybody's looking for education to get out of being underemployed and being employed correctly or better, I think is the right term, as well as health and medical services. So those are all the same. However, when you look at the different shades of those kind of three things, that's when you start to see some of the differences. Health and medical services, that transportation is a little bit more difficult for the rural community to get to the Raudebush VA Center than it is for downtown. So that while they're both looking for the health and medical services, the transportation issues within those services are different depending on where you go. Same thing with employment and education. A lot of the rural communities are looking for different kinds of employment than the urban areas. So they are the same if you put them in 3 or 4 large buckets, but the differences within those buckets is definitely visible.
Okay, great. Thank you. Are you also able to tell our viewers a little bit about how Indy Warrior Partnership fits into all the services that you just discussed that are already available in Central Indiana, and how those services provide an upstream approach to veteran suicide and self-injury deaths?
Yeah, so the Indy Warrior Partnership is continuing its mission to improve the quality of life for veterans around the city and around Central Indiana, as well as their families, their caregivers across Central Indiana. The model we are using ensures that we are not waiting for a veteran who's in crisis to find us or find necessary services. Through building relationships with them and trying to stay ahead of potential crises so that we can leverage the community to mitigate the tragedy of them dying by death by suicide. And we use a 4-step plan in our community, and it's the community integration model of connect, educate, advocate, and collaborate. So with Connect, we connect to veterans, community partners, and key stakeholders to build trusted relationships between everybody. With regard to education, we educate veterans on the resources available in their communities and how to get in touch with them. We educate the community as well to what the veterans' needs are and what they're asking for, what they're looking for. We also advocate for veterans' needs locally and beyond to fill those gaps in those services. We find them and fill them. And lastly, we collaborate with the service partners, businesses, and leaders to best support veterans holistically and to strengthen our community as a whole.
Yeah, yeah, absolutely. That connection, meeting your veterans, because everything else follows from that, right? And with your relationship that you engage with your veterans, and then the fourth step precedes that initial engagement. As our regular viewers know, every veterans community is unique. As I used to describe Marion County, and the differences even just between like one county and the circumstances surrounding veterans. And they're very distinct on where they're located in the country. Because of this, challenges impacting our veteran in one state may be vastly different from another. And we always say one size fits one. You know, you did a beautiful example of that. You know, I'm talking about state to state, but you just talked about the vast differences just within one county of the whole of Indiana. Our goal with Operation Deep Dive is to understand these challenges and more importantly, address how community leaders can be a part of the solution. With that goal in mind, Matt, would you tell us more about Operation Deep Dive in Indiana, maybe a little bit of experience that you've had, because I know you have a great partnership with the Coroner Medical Examiner Office there for Marion County. Could you tell our viewers a little bit about that in Operation Deep Dive?
Yep. So thanks, Cheree. So Operation Deep Dive has two real components, right? It's the gathering of the death data, and then it's also the interviews. The gathering of the death data is key because we send that to the DoD to validate who and to verify if any of those were had served in the military, be it honorably, dishonorably, whatever it is. And the second component is the interviews. So, and those are probably the most essential part. I mean, the data is the foundational piece, but I think the interviews are the biggest piece to really understand what was going on and kind of piece together the veterans' last few months or few years of their life. So there are interviews with relatives, loved ones, friends, colleagues, anybody who was around that veteran, so that we could kind of piece together and find. And when we do multiple of these interviews, we start to find like points or like situations where the community can really get involved to try to affect veterans in the future from death by suicide. So I really think this is a great program for us to identify some of those issues so that we can really attack them. And you hit on it too, Cheree. Our relationship with the coroner here is fantastic. They have really signed on. The coroner is actually a veteran and very proactive in finding and trying to figure out ways to alleviate death by suicide, especially amongst our veterans.
Mm-hmm. Yeah, absolutely. And just to add to what you said, you know, it's from these interviews in particular, as well as information like we're getting from the Coroner and Medical Examiner's Office and in other places, you know, other states from vital statistics, is not necessarily reevaluating what we've already evaluated, but to see what we haven't evaluated, right? And to see what is the differences, as you said, and the trends related significantly to the veteran population. So how can our viewers in Indiana get involved in Operation Deep Dive and become a part of our larger team that's focusing on ending veteran suicide and self-injury deaths?
So if you have lost a veteran to suicide, unfortunately, or self-injury, we encourage you to step forward and to call for an interview. Now, that death should have happened within the last 24 months because we want to keep the data and the information relevant. But we want to try to piece together that veteran story and find out where some of those areas are that we could have intervened before the death. If you're not eligible for an interview, then we really could use the pub. You know, push us out on Facebook, Twitter, or Instagram. If you know of anybody who has a loved one or a family member who has died by suicide, then we'd like to talk to them as well. And the more interviews that we can get, the better the data that we can get, and the more that we can positively affect this community, to really take a big swing at dropping that veteran suicide number. And not just here in the Central Indiana, but all Hoosiers. I encourage all Hoosiers to leverage local and national organization resources. If you're affiliated with a particular community organization, don't assume someone knows about your organization's resources. One mention of a local or national resource during a collaborative meeting could really help someone searching for assistance. It just takes one kind of instance, and you don't know where people are going to find you. Veterans also should know that there's a wide range of programs and services available to them. If you're facing an urgent crisis, you should always call the Veteran Crisis Line by dialing 1-800-273-8255 and pressing the number 1. I can tell you from experience, it is good to have that logged in as a contact on your phone, because if somebody calls you, you don't want to be looking that up. You can just text them that contact information so that they have it right away. And I've also called that number and talked to somebody just to see if it worked. Is there actually somebody there? And the time I called, there definitely was somebody there, and she was a licensed clinical social worker. So it does work. You can also, if you don't like to talk, you can also send a text message to 838-255. The text works. Somebody will text you back, and it is actually somebody. It's not a bot. But for more information, if you don't have those numbers handy, feel free to reach out to IWP. You can get me at mhall@indywarriorpartnership.org, or by calling 317-352-5413. I think that those numbers, that information is going to go into some chat or somewhere, so somebody can copy and paste those. That phone number is also the phone number to our case coordinator, and that phone gets answered 24/7. So if there isn't somebody there, somebody will answer and take down your information and call you as soon as they can.
All right. Yeah, thank you, Matt. And I think you hit the nail on the head. Collectively, us leveraging local and national organization resources is a critical piece. And if you believe you or your organization has a small following, there's likely a veteran family member or caregiver in your network, as Matt was talking about, who would benefit from this information. Matt, is there anything else you'd like to add?
It just that I really, this was a program that was brought to us a few years ago, and we bought in hook, line, and sinker as soon as it was brought to us. Anything that we can do to help veteran suicide, we're going to do, including getting the data. I think the data is key, and I think this is a great idea and a great concept on how to really take a big swipe at ending veteran suicide. So anybody else who wants to hear a cheer rah speech from me about OPDD, feel free to reach out, and I'll sing their praises again.
Thank you, Matt. I'm just gonna cover some stuff we've already talked about, and you've heard Matt speak of, just as a summary. If your friend or loved one, coworker, was sworn into the service for one day, they qualify for the purposes of our study. It does not matter which branch they served in, whether they completed a combat deployment, that they raised their hand and they served, and they died by suicide or self-injury, a self-injury death. I want to talk about a little bit more about what the goals of the interviews are. The goals of these interviews is to understand how the former service member or veteran was engaged within their community and how the community can better support veterans in the future. You heard Matt say a little bit about the eligibility criteria. I just also want to add that you must be 18 years or older, and you must have had a relative, loved one, friend, or coworker who was a veteran and died by suicide or self-injury within the last 24 months. That individual could have served as little as one day. I keep reiterating that, but I can't say that enough, and received any type of discharge. If you are eligible and would like to participate or know someone who may want to participate in the interviews, please visit americaswarriorpartnership.org/deep dive to contact our research team. Okay, that is all the time we have for today. I want to thank you all for joining our discussion, and please stay tuned to America's Warrior Partnership Facebook page for information on future Operation Deep Dive discussions and updates. For more information on Operation Deep Dive, please feel free to visit americaswarriorpartnership.org/deep-dive. Thank you, everyone.